Let me tell you about Margaret. She was 68 years old. Sharp mind, active life. She gardened every morning, walked her dog every evening, and cooked her own meals from scratch. She wasn't the kind of person who ran to the doctor every time something felt off. In fact, she was proud of that. She'd seen friends go in for one test and come out with 3 prescriptions, 2 follow-up appointments, and a fear that never quite went away. So Margaret made a decision. She would be smart about this. She would not let the medical system pull her into that cycle. And for a while, it felt like the right call, until the day she couldn't see the curb clearly enough to step down safely. She caught herself. Barely. A few weeks later, her daughter convinced her to get her eyes checked. Just once. Just to be sure. What they found wasn't catastrophic, but it was serious, and it had been building for 2 years. The doctor looked at her and said something she never forgot. If you had come in just 6 months earlier, this would have been a 5-minute fix. Margaret didn't avoid tests because she was careless. She avoided them because nobody ever explained to her which ones actually mattered. And that is exactly why you're here today. Because here's what no one is telling older adults clearly enough. Not all medical tests protect you. Some of them pull you into a system that creates more problems than it solves. More appointments, more anxiety, more procedures that lead to other procedures. But some tests, the right ones, at the right time, for the right reason, can be the difference between catching something early and dealing with something devastating.
Staying
the
active
problem
is key to your well-being.
Most people don't know
Regular
the difference,
exercise can make a
and
big
that
difference.
Uncertainty,
I've got your health
that's what
needs
leads
covered.
to 2
You can
dangerous
trust the process.
extremes. Either people test everything, constantly, and live in a permanent state of medical anxiety, or they test nothing, trust nothing, and miss the one thing that could have changed everything. You deserve better than both of those options. If this kind of conversation is what you've been looking for, honest, calm, and built around your reality after 65, then make sure you're subscribed to this channel right now. Hit that button, turn on the bell, because this is the kind of content we make here every week. Now, I want to be very clear about something before we go any further. I'm not here to tell you to do more tests. I'm not here to push a checklist at you or make you feel like your health is one missed appointment away from disaster. I'm here to help you understand something more valuable than any test result. I'm here to help you make smarter decisions about which tests actually serve you and which ones you can confidently, thoughtfully say no to. Because here's what I've noticed after speaking with and researching the experiences of thousands of adults over 60. The people who navigate healthcare the best after 65 aren't the ones who follow every guideline blindly. And they're not the ones who reject the medical system entirely. They're the ones who ask better questions. They walk into a doctor's office knowing why they're there, what they're looking for, and what they'll do with the answer. That's a completely different kind of power, and it's available to you right now, today. I also want to acknowledge something. If you've had a bad experience with a doctor, you're not alone. If you've ever felt rushed, dismissed, or like you were being processed rather than cared for, that feeling is valid. If you've ever left an appointment with more confusion than you walked in with, that's not your failure. That's a gap in how healthcare communicates with patients. And if you've watched someone you love go through a cascade of tests that led to stress, side effects, and no real answers, your skepticism is earned. I'm not asking you to throw any of that away. I'm asking you to add one more layer of understanding on top of it. Because skepticism without information can protect you from bad tests, but it can also cause you to miss the right ones. And the goal today is to make sure you know the difference. So before we get into the 7 tests, I want to give you a simple framework. 3 words, easy to remember, powerful to apply. The right test, the right time, the right reason. That's it. Not more tests, not no tests. The right test, at the right time, for the right reason. Let me explain why this matters so much. Some medical tests, when used correctly, prevent years of suffering. They catch something small before it becomes something irreversible. They give you and your doctor a clear picture and a clear path forward. Those tests are worth every minute of your time. But other tests, especially when done too frequently or without clear purpose, or in someone whose overall health makes the result more confusing than helpful. Those tests can open doors you didn't need to open. They can lead to biopsies for things that never would have caused harm, to medications for numbers that didn't need to be treated, to anxiety that follows you home and never really leaves. The medical community has a term for this: overdiagnosis. And it's real. It affects millions of older adults every year. Not because doctors are malicious, most aren't, but because the system wasn't always designed with your specific stage of life in mind. After 65, your body has different needs. Your risk profile has shifted. What was urgent at 45 may be irrelevant at 70, and what was easy to ignore at 50 may now be quietly critical. The right test, right time, right reason framework helps you navigate all of that. It helps you walk into any appointment and ask, does this test fit my situation right now for a reason that actually changes what we do next? If the answer is yes, do it. If the answer is unclear, ask more questions. If the answer is no, you have the right to say so. All right, let's get into the 7 tests, and I'll tell you right now, test number 4 is the one most people quietly skip because it feels less urgent than the others. It almost never makes headlines. But the people who catch it early, they'll tell you it changed everything. Keep watching. Let me tell you about Ronald. Ronald was 71, retired engineer, meticulous about everything in his life, his finances, his car maintenance, his garden schedule. But blood pressure checks? He figured that was for people who were obviously sick. He felt fine. He slept well. He wasn't overweight. He didn't smoke. What could possibly be wrong? His daughter bought him a home monitor as a birthday gift. He used it once out of politeness and put it in a drawer. 8 months later, Ronald had a minor stroke. Minor. He recovered well, but his neurologist said something that stayed with him. Ronald, your pressure was probably elevated for over a year. This was preventable. Here's what makes blood pressure so deceptive after 65. It doesn't announce itself. There's no pain, no obvious symptom, no moment where your body says, pay attention to this. It just builds quietly in the background, putting silent pressure on your heart, your kidneys, your brain, until one day, it isn't silent anymore. And here's something many people don't realize. Blood pressure patterns change as we age. The cardiovascular system becomes less flexible. Readings that were stable for decades can shift without warning. When does this test matter? If you haven't had a reading in the last 6 months, it matters now. If you've had any changes in your sleep, your energy, your vision, or your ability to handle physical activity, it matters now. If you have a family history of stroke or heart disease, it has always mattered. When might it be less urgent? If you're already monitoring regularly and your numbers have been consistently stable for years, you don't need to obsess over daily readings. In fact, checking too frequently can create its own anxiety, which ironically affects your numbers. The goal isn't constant surveillance. The goal is a clear, calm baseline, checked regularly enough to notice change, but not so often that the monitor becomes a source of stress. A simple home monitor, used 2 or 3 times a week at the same time of day, can give you and your doctor more useful information than a single annual reading taken in a clinical setting where you're already anxious just from being there. That's a small habit with an enormous return. This one is quieter than most people expect. Patricia was 67. She ate reasonably well. She wasn't carrying a lot of extra weight. She didn't think diabetes was part of her story, but she had been feeling tired in the afternoons, slightly blurry vision now and then, healing more slowly from small cuts than she used to. She mentioned these things to her doctor almost as an afterthought, at the end of an appointment about something else entirely. Her doctor ordered an A1C test. It measures your average blood sugar over the past 2 to 3 months, not just a single snapshot, but a pattern. Patricia's number came back in the pre-diabetes range. Not diabetes, not a crisis, but a clear signal that something was shifting. With one change to her morning routine and a small adjustment in how she structured her meals, her number came back to normal within 6 months. No medication, no dramatic intervention, just early awareness and a targeted response. Why does this matter so much after 65? Because the risk of developing type 2 diabetes increases significantly with age, and it often develops without the classic warning signs people expect. And unmanaged blood sugar over time affects nearly every system in your body: your heart, your kidneys, your eyes, your nerves, your ability to heal. Catching it early, especially in the pre-diabetes stage, is one of the clearest examples of a test that genuinely changes outcomes. When is it necessary? If you've never been tested or haven't been tested in the last 2 to 3 years, and you carry any of the common risk factors, family history, changes in energy or weight, high blood pressure, this test is worth having. When might it be less urgent? If you were tested recently, your numbers were solidly normal, and nothing in your lifestyle or health has changed significantly. You likely don't need this every single year. Your doctor can help you determine the right interval based on your specific profile. But if there's any uncertainty, if you've been feeling off in ways you can't quite explain, this is a simple blood draw that can answer a lot of questions at once. Margaret. You'll remember her from the beginning. Her story is the story of millions of adults over 65 who think vision changes are just part of aging, something you adapt to, not something you address. And sometimes that's true. But sometimes, what feels like normal aging is actually something specific, something with a name, something that responds very well to early treatment and very poorly to late treatment. Glaucoma, for example, develops so gradually that most people don't notice it until significant damage has already occurred. There's no pain. The peripheral vision goes first, slowly, almost imperceptibly. By the time most people notice something is wrong, the window for the easiest intervention has often passed. Macular degeneration follows a similar pattern. It's the leading cause of vision loss in adults over 60. And yet, caught early, there are real options, real tools, real ways to slow or manage its progression. Cataracts are different. They're slower, more visible in how they affect daily life, and highly treatable. But knowing what you're dealing with changes how you plan, how you drive, how you protect yourself from the kinds of accidents that vision problems quietly enable. When does this exam matter? After 65, a comprehensive eye exam, not just a glasses prescription check, but a full dilated exam that looks at the health of the eye itself, is generally recommended every 1 to 2 years, even if your vision feels fine. Because what feels fine and what's actually happening inside the eye are not always the same thing. When might it be less pressing? If you had a thorough exam within the past year with no findings of concern, and you're not noticing any new changes in your vision, you likely have time before the next one. But if it's been more than 2 years, or if you've noticed anything, halos around lights, increased sensitivity, subtle shifts in how you see contrast or color, that's a signal worth responding to. Your eyes are not just about seeing clearly today. They're about staying safe, staying independent, and staying connected to the world around you. That's worth protecting. Here it is. The one most people skip. Not because they think it's unimportant, but because hearing loss tends to arrive so gradually that the mind compensates without even realizing it. You turn up the television a little louder. You ask people to repeat themselves and assume they're mumbling. You avoid noisy restaurants because they're too chaotic. You drift slightly out of conversations in groups and tell yourself you never liked small talk anyway. None of these feel like symptoms. They feel like preferences, like personality. But here is what the research is telling us, clearly, consistently, and with growing urgency. Untreated hearing loss in adults over 65 is one of the strongest modifiable risk factors for cognitive decline. Not a minor correlation. A significant one. When the brain works harder to process incomplete sound signals, it diverts resources. Over years, that redirection takes a toll. Social withdrawal follows hearing difficulty, and social isolation compounds cognitive risk further. This isn't about vanity. It isn't about hearing aids or what they look like. It's about protecting your brain by protecting your ears. When does a hearing assessment matter? If you haven't had one since before 65, it matters now. A baseline hearing assessment gives you and your doctor something to compare against in future years. If anyone in your life, a partner, a child, a close friend, has mentioned that you seem to be missing parts of conversations, that observation is worth taking seriously. When might it feel less urgent? If you recently had an assessment and your hearing was within normal range and nothing has changed, you have some runway before the next one. But given how quietly this particular change tends to arrive, waiting until it's obvious means waiting too long. The people who catch this early and address it, even with simple modern hearing support, often describe a return to conversation, to engagement, to connection that they didn't realize they had been slowly losing. That kind of return is remarkable, and it starts with a test that takes less than an hour. This one requires some nuance, and I want to give it the careful treatment it deserves. Because bone health is one of those areas where the conversation has become oversimplified in both directions. Some people hear bone density scan and immediately think medication, side effects, a diagnosis that changes how they see themselves. Others hear it and think, of course, everyone over 65 needs this regularly. Neither of those responses tells the whole story. Here's what we know. Bone density naturally decreases with age. That process accelerates after menopause in women and happens more gradually but still meaningfully in men. And bones that become less dense become more vulnerable to fractures, to breaks, to the kind of fall that changes a life trajectory overnight. Hip fractures in particular carry consequences that go far beyond the fracture itself. Recovery is long. Complications are common. And the loss of independence that can follow is something that quietly terrifies many older adults, even if they don't say it out loud. A DEXA scan, a low-radiation imaging test that measures bone density, can tell you where you stand, not to alarm you, but to inform you. Because if your bones are losing density, there are real, evidence-based responses. Some involve nutrition. Some involve specific types of exercise, particularly weight-bearing and resistance training, which have a direct and meaningful effect on bone strength. Some involve conversation with your doctor about whether additional support makes sense for your specific situation. When does this test matter? For women over 65, most clinical guidelines suggest at least one baseline DEXA scan because the risk profile at this stage makes the information genuinely useful. For men, the conversation is more individualized. Risk factors like long-term steroid use, certain medical conditions, significant height loss, or a family history of osteoporosis shift the calculus. When might it be less necessary? If you've had a recent scan with strong results and your lifestyle includes regular weight-bearing activity and adequate calcium and vitamin D, you may not need this test on an aggressive schedule. If your doctor recommends frequent repeat scans without a clear reason tied to your specific situation or a change in your health status, that's worth questioning. The goal of this test is not to create a diagnosis that follows you forever. The goal is information. Specific, actionable information that helps you make better decisions about how you move, what you eat, and what risks you take. That's a very different thing from fear. And when you approach it that way, it becomes a tool, not a threat. I want to spend a little more time here, because this is the area where the conversation most often goes wrong, in both directions. There are people who have avoided cancer screening for years out of fear of what they might find. And there are people who have been over-screened, tested repeatedly for things that, given their age and overall health, were statistically unlikely to ever cause them harm, and ended up in a cascade of biopsies, procedures, and anxiety that took years off their peace of mind without adding a single day to their life. Both of those outcomes are real. Both of them matter. So let me be very direct about how to think about this. Cancer screening after 65 is not a single conversation. It's several conversations, each one specific to a type of cancer, a personal risk profile, an overall health picture, and a very honest discussion about what you would actually do with the information. That last part is the one most people skip. Let me say it again because it changes everything. What would you actually do with this information? If a screening test found something early, and the treatment for that finding would be aggressive, difficult, and potentially harmful to your quality of life, is early detection still the right goal for you? For many people, the answer is yes, absolutely, without question. For others, particularly those with significant other health conditions or those for whom quality of daily life is the primary value, the answer is more complex. Neither answer is wrong. But you can only give a real answer if someone actually asks you the question. Colorectal cancer screening remains one of the most clearly beneficial screenings available for adults in their 60s and into their 70s. Colonoscopy, or newer stool-based tests that have become increasingly accurate, can catch precancerous polyps before they become cancerous and remove them during the same procedure. This is the kind of screening that earns its place, not because the test itself is pleasant, but because the outcomes are real and the window for intervention is wide. Lung cancer screening with low-dose CT is recommended for adults between 50 and 80 who have a significant smoking history, specifically those who currently smoke or quit within the past 15 years. For this group, the evidence for screening is solid. For non-smokers without specific risk factors, routine lung screening is generally not recommended, and doing it anyway can lead to false positives, unnecessary follow-up procedures, and significant anxiety. Breast cancer screening for women over 65 is an individualized conversation. Guidelines differ between organizations, and the right answer depends on your personal history, your density, your overall health, and your values. Prostate cancer screening for men is similarly nuanced. PSA testing has both clear benefits for some men and documented potential for overdiagnosis in others. This is genuinely a conversation, not a checkbox. Cancer screening after 65 should be a personalized, thoughtful decision, not a routine that continues by default past the point where it serves you. If you have a doctor who explains why a specific screening makes sense for you specifically, your age, your history, your health, your risk factors, that's good medicine. If you're being screened because that's just what you do every year, without that conversation having happened, it's worth asking for it. You are allowed to ask, why this test? For me, right now, and what happens next if the result is positive? Those questions don't make you a difficult patient. They make you an informed one. This is the one that carries the most emotional weight. I know that. The word cognitive, for many people over 65, carries a particular kind of fear. A fear that doesn't announce itself loudly, but sits quietly in the background of daily life. Did I leave the stove on because I was distracted? Or because something is changing? Is this normal forgetfulness, or something I should pay attention to? Is the word I couldn't find for a moment a sign? Or just a tired afternoon? These questions are real. They deserve a real answer. And here is what I want you to understand. A cognitive baseline assessment is not a test you take because something is wrong. It's a test you take so that you have a clear picture of how your mind works right now, at its best in ordinary health, so that if something does change in the future, you and your doctor have something real to compare against. Think of it like a photograph, not a diagnosis. A photograph. It captures where you are today, your memory, your processing speed, your attention, your language, so that in 5 years or 10 years, if a question arises, the answer isn't a guess. This matters enormously because cognitive changes, when caught early, are no longer the inevitable one-way story they once seemed to be. Lifestyle factors, sleep quality, physical activity, social engagement, hearing health, blood pressure control, purpose, and mental stimulation have real, measurable effects on cognitive trajectory. Knowing where you stand gives you the ability to act while action still makes the biggest difference. When does this assessment matter? If you're between 65 and 75 and have never had any kind of cognitive baseline established, this is worth discussing with your doctor, not because anything is wrong, because having that baseline is one of the most intelligent investments you can make in your future self. When might it feel premature? If you're younger than 65 and have no risk factors or concerns, there's no urgency. If you've recently had neurological evaluations as part of another health process, you may already have that baseline. But if you're in the window, if this is the decade where that photograph would serve you best, consider having the conversation. Not out of fear, out of the same intelligent foresight that makes you check your blood pressure, that makes you protect your vision, that makes you take seriously the things that matter most. Your mind is worth that same intentional care. We've covered a lot of ground today, and I want to bring it back to where we started. Margaret. Gardening every morning, walking her dog every evening, proud of her independence, wary of a system that she had seen overwhelm people she loved. She wasn't wrong to be careful. She was just missing one piece of information, the piece that says, careful doesn't mean avoid everything. Careful means choose wisely. The right test, the right time, the right reason. That's the framework that changes how you walk into any medical conversation from this point forward, not with fear, not with blind compliance, but with clarity. You don't need more tests. You need the right ones, the ones that give you real information at a moment when that information can actually change what happens next. The ones that protect your independence, your clarity, your ability to stay fully present in the life you've built. Those tests are worth your time. The others, the ones driven by habit, by default, by a system that wasn't designed with your specific season of life in mind, those deserve your questions. Ask why. Ask what happens next. Ask whether the answer to this test would actually change anything. And if no one can give you a clear answer to those questions, you're allowed to wait. You're allowed to seek a second opinion. You're allowed to say, not yet, not without understanding this better. That is not resistance. That is wisdom. If this conversation helped you see your healthcare decisions a little more clearly, I'd love to know. Drop a comment below and tell me, which of these 7 tests surprised you most? Which one are you going to bring up at your next appointment? And if this is the kind of honest, grounded health conversation you've been looking for, give this video a like. It helps more people find content that actually respects their intelligence and their experience. You've been watching a channel built for people who want to understand their health, not just manage it. And right now on your screen, there's another video waiting for you. One that continues this conversation in a direction I think you'll find just as valuable. Go ahead and click it. I'll see you there.